A man in his 20s has tested positive for the coronavirus here in Boston. Health officials say he flew into Logan Airport on Tuesday from Wuhan, China.
His arrival was one day before the airport began screening for coronavirus.
At this point in time, I would argue that the situation in Massachusetts is still relatively low risk.
I think this is a very fluid situation, and it's moving forward.
Tonight, a rapidly evolving public health emergency.
Be aware of the symptoms, the fever, cough, and shortness of breath.
A new case of the deadly coronavirus has been confirmed in the U.S. The latest case in Massachusetts.
Tests from Massachusetts and New York still have to be sent down to Atlanta, so they're going to have to ramp this up and quickly.
To test.
From an epidemiological perspective, it was abundantly clear that all of this was going to play out exactly how it did. I felt like I had binoculars and I was watching a tidal wave rushing towards us full steam, but from very far away still. And it was just apparent that there was no way out and we had to prepare, but other people didn't have the right binoculars.
From the time I started my chemotherapy treatments in late August of 2019, I really didn't do very much. I couldn't go to the gym any longer because of the chance of germs. My immune system was going to be very low. No large crowds, no airplanes. The things that people are doing today to prevent the spread of coronavirus, I was actually doing since last August. I got up on Sunday, March 1st, and went into the bathroom and passed out. The paramedics came in and got me into the ambulance and got me to Berkshire Medical Center in Pittsfield. Had body chills, freezing cold, shaking and shivering. That was the virus, and at that point I didn't know it yet.
I was a chaperone on a school trip. We went to Italy, France, Monaco, and Spain, all within a 10-day period. We landed on the 15th in Milan, and we came home on the 22nd of February. But there still really wasn't any screening process for this. We got on our coach bus to go back down to Rhode Island where our school is. I had started to feel sick. My lungs felt heavy. So I make an appointment for that day. I get to the doctors. They didn't have the ability to test me at the time.
And I'd been receiving treatment for Hodgkin's lymphoma, which is why I was in Boston. And there was this Biogen Managers Conference that was happening, and my friends were there. We kind of all met up in a lobby area. It was a good time. I'm glad we met. Unfortunately, we all got sick. I woke up and had classic COVID-19 symptoms. I was coughing. I had a really sore throat. My eyes and sinuses were burning. It felt like I had inhaled Tabasco sauce or something. My fever had spiked to about 102, 103. And I felt like my body felt like I had the worst flu I'd ever had. Called the ambulance. They came. Mass CPH had said, has she traveled outside the country or has she had contact with somebody who's a known positive? And at that point, I had not heard or seen from my friends. I really wasn't paying attention because I wasn't feeling well. And the doctor was frustrated because DPH said, no, doesn't meet the CDC criteria. We can't give you a test.
Dr. Kaliko is a contagious disease specialist physician at Berkshire Medical Center in Pittsfield, Massachusetts. Behind the scenes, she was trying to get the state of Massachusetts and the CDC to give her permission to test me for COVID-19, which was denied a couple of times because I haven't traveled. That's the criteria they had used. If you didn't travel, then you can't test.
All of the delays in testing, as far as I can tell, are really in some way rooted in this confusion over whether or not this was going to be a problem for the populace. And this led us to completely squander the month of January and more or less the month of February. As far as testing is concerned, probably somewhere in mid-February, that the major manufacturers that I was speaking to still had not necessarily decided whether or not they needed to build a test for this virus. And the fact that that was still a question, given what we knew of the virus, is just incredible to me.
March 2nd rolls around. It's Monday. And I'm just like, it's fine. Everybody on that trip is now quarantined till the 7th. And I get a call at like noontime with the news. And they're like, so we take 2 swabs from you. The one in your nose has tested negative. And I was like, oh my God, that's great news. And they're like, the one in your throat has tested positive though. So you have the coronavirus.
They got me into a wheelchair with a mask on. And I remember them scurrying me down the hall to the elevator like it was a fire drill. They just cleared the hallway and got me into ICU, into an isolated room. And I remember saying bye to my wife, but I couldn't touch her or kiss her.
I think there's been 4 marathons canceled right now. We're not there in Boston right now, yet.
How about the parade next week?
No, we're not there yet. We're monitoring the situation literally day by day to see what's going on. And again, talking to the medical experts, getting the information from them, not reacting.
This evening, dozens of people were taken from this hotel to the hospital for coronavirus testing. They may have been exposed at a recent Biogen conference.
The general public in Massachusetts remains at low risk, but we are planning and preparing for the potential for more cases to develop here.
The state now says of the 7 presumptive coronavirus cases here, 5 attended the management conference at Boston's Marriott Long Wharf Hotel last week.
They called me first with the result. I was never contacted by DPH to do contact tracing, which was shocking to me.
It was the Berkshire medical nurse. They came in to tell me I tested positive.
We started contact tracing right away. We didn't wait for the governor to elect Partners in Health to do it. We just did it. I was in Boston at a volleyball tournament with my youngest daughter. I got the call that we had our first positive case in Berkshire County and that I had to, immediately investigate this person and find out what was going on.
And she was asking me some times and dates.
Because we were trying to track where he might have potentially caught this when we realized it was community acquired. I also have been a nurse a long time and know that this year we had a lot of people that should have tested positive for flu that didn't. There was a lot more pneumonia this year than we've seen in a long time. I honestly believe it was in Berkshire County for at least a few months before the first person was swabbed.
Today, I'm declaring a state of emergency in Massachusetts. This declaration will give our administration more flexibility to respond to this evolving outbreak.
The world had changed in 14 days when I was in the hospital. And on the way home, it's about a 40-minute ride. Route 8 from Pittsfield to North Down is a very busy road. Hardly anybody. It was like you were driving at 3 o'clock in the morning. Got me home, one of the happier days of my life to get here.
Our administration was not saying anything to anybody. Say, hey, there's a positive case downstairs. Be careful. Don't go down there if you don't have to. The 22nd of March on Sunday, and we had a notification from Mr. Walsh's secretary that there was a COVID positive case in the building. And then, reality hit. Oh my God, it's here.
By taking this action now, we can significantly improve our position in this fight to slow the spread of this virus.
I told him, I said, thank you for letting me take care of you. And I said, you go when you want to go.
The breaking news about the Holyoke Soldiers Home. Governor Baker now taking new steps to find out what led to the tragic deaths of veterans at that home.
I didn't find out that I was positive until April 2nd. When they finally called me, it was brutal. So, going through it, I can only imagine what my veterans went through.
I would say April was really defined by getting the commercial tests up and running. From my perspective, so much of April was spent educating the public about what these tests mean. Testing remains very limited. It's not so much even the tests themselves anymore, it's the availability and accessibility to just get the tests? How does a low socioeconomic status individual find their way to getting a test at a drive-through at a partner's healthcare institution? You know, that's not equitable testing. And so really getting testing to the masses has just been a bit of a nightmare. Everything that could go wrong has gone wrong.
In the beginning of April, we had enough swabs to test the people that were symptomatic, people that were in the hospital. I think everybody wanted the contact tracing, the contact swabbing back then, which we could not do because we didn't have enough swabs.
The global supply chain broke down. The major manufacturer of these swabs is Copan, which is based in Lombardy, Italy. So the factory that needed to create the swabs for the rest of the globe to test their populace was essentially out of commission because the workers at that factory had the virus that needed to be tested for.
I felt this guilt, like I'd forced all these people to put a pause into their life. I was very lucky. It got confirmed that nobody from the people who were quarantined because of me got sick ever. So I got lucky with that. I got lucky that I got better. I got lucky because it didn't get worse.
What impacts us the most is when we go into our building, we have an entire third floor that is empty. Units that hold usually 24, 25 guys, gone. We have lost the whole entire floor of veterans.
Massachusetts is known globally as like the best hospitals in the world. And yet public health is, I don't know.
And so I think that what we will see as a lasting effect of this pandemic is a renewed interest in ensuring, A, that this doesn't happen again, that we have early warning signs, that we have global surveillance efforts set up in a more robust way. It's helping us to, as a society, understand that preventative healthcare, including preventative public health care, is crucial.